Cancer. A disease that scares us the most. If you know the famous HEISENBERG, then you know how cancer can change the life of a person. Since many centuries, cancer is considered as one of the deadliest diseases. Around 10 million people die because of cancer each year, and this makes it one of the most uncontrollable diseases of this century. The modern medical science, delicately trying to invent medicines of the diagnosis process that can cure cancer, and after ages of research, we have got something hopeful. U.S. medical scientists have achieved surprising results by applying the experimental drug called Dosterlimab to rectal cancer patients. 12 patients took the drug for at least 6 months, and the cancer disappeared from the body of each of them. This is made possible only by using drugs, and without any surgery, chemotherapy, or radiation. Such a 100% success rate is rare in the history of cancer research. But how far we have progressed in the treatment of cancer? To understand, we have to start from the beginning, and you need to learn more about cancer. When any cell in the body keeps dividing and spreading uncontrollably, then it is called cancer. Initially, cancer stays limited to a specific part of the body, but later it usually spreads to other parts as well. This spread is expressed through different cancer stages. It is also treated differently depending on the stages. Cancer can occur in different parts of the body, and doctors call cancer by the name of the affected organ, such as breast cancer, lung cancer, or rectal cancer. But the diversity of cancer does not end here. The uncontrolled division of cancer cells is due to the mutations in the DNA of the cells. Its treatment, therefore, depends on which organ and mutation the cancer is caused by. During the uncontrolled division of cancer cells, the immune system of the human body becomes cautious. It tries to protect the body from cancer cells by destroying them. When a cancer cell mutates, it also creates some strange type of protein cells. Seeing such strange unknown proteins, the body's immune system recognizes them and destroys the cancer cells. To hide and protect themselves from the immune system, cancer cells use a technique. It develops a different protein, named the PD-L1 protein. This protein deactivates the T cells of our immune system. This is a kind of lymphocyte, which is the major component of the immune system of the human body. If somehow, cancer cells can be prevented from producing PD-L1 protein, our immune system can easily destroy the cancer cells. Using this idea in 2017, Dr. Luis Diaz Jr. conducted a study on rectal cancer. The study was conducted on metastatic cancer patients, which means cancer samples that have spread from one organ to other parts of the body. In the study, 21% of patients recovered completely and 53% of patients had smaller tumors. The doctors thought to conduct another study, including cancer samples in the early stages. But this time the study included only patients whose cancer was large but had not spread from the rectum to other organs. Besides, the patients could not receive conventional cancer treatments, such as chemotherapy or radiation, or any other type of immunotherapy. It took about 2.5 years to enroll only 16 patients in this study. Patients included in the study received a drug named Dosterlimab. Each dose of this medicine was 500 milligrams. The patients took 8 doses in 6 months. Patients enrolled in the study were seen for follow-up once every 4 months. The original plan was that those whose cancer remained after taking these drugs would receive chemo, radiotherapy, and surgery. But 12 of the 16 who completed all doses at 6 months had no signs of cancer after 3 different tests: MRI, endoscopy, and digital rectal examination. After 6 to 25 months of follow-up, the patients showed no sign of their cancer returning. So they did not have to take any alternative treatment. The remaining 4 have not yet completed their 6-month doses of the drug. But they are also on the way to recover from cancer. The number of patients with this particular type of rectal cancer is 5 to 10% of the total cancer patients. But the researchers are optimistic that this treatment will be able to be used to treat this particular cancer, as well as other types of cancer such as the pancreas, stomach, or prostate. As a result, these cancers may be cured in the future only by taking medicine. Cancer treatment using surgery, chemotherapy, or radiation is not only difficult for the patient, but also has long-term effects on the patient's life. A large proportion of rectal cancer patients are women. Conventional treatments can destroy their fertility. Apart from that, the incidence of rectal cancer is increasing at a young age. The editorial of the New England Journal of Medicine, Dr. Hannah Sanoff, said, "The results of this study are quite promising. But now it is not possible to use it instead of conventional treatment. The scope of this study is very small, and the patients have been observed for a very short time. Apart from that, all the patients were treated in only one hospital. More patients with this treatment and longer follow-up are needed for this study to be conclusive." The doctors plan to continue the study until a total of 30 patients are given Dosterlimab. At the same time, they will monitor whether a patient's cancer has returned or not. They are hopeful that Dosterlimab will soon be accepted as an acceptable treatment for rectal cancer.